Hi, my name's Beth. I'm one of the students from George's and I'll be teaching you a little bit about lung cancer today. The first slide has a few different learning outcomes that I think you should be able to do by the end of the video. You can come back to this slide and use them to test yourself at the end. Lung cancer is the second most common cancer in the UK and it's the most common cause of cancer deaths. This is the case for both men and women, and it's mainly due to the fact that it has a poor prognosis. The 5-year survival rate is less than 10%. So we know that there are a few things that make you more likely to get lung cancer, and the main factor is cigarette smoking. So this is something that about 85% of lung cancers can be attributed to, and that's because it contains carcinogenic compounds. There are also a few other things that if you're exposed to will increase your risk of lung cancer, and these are things like asbestos, radiation and radon gas. There are also different genetic factors that come into play, and these are found to be more important in the non-smoking group of people. So things like EGFR gene, as well as other sorts of gene mutations. And then you've also got the age. So we tend to see lung cancer in the age group of around 50 to 60 years old. So how might someone with lung cancer present? Let's break down some of the different clinical features to try and understand what it is that causes them. I find this really helps me to remember them. So we've got local symptoms and signs. So these will be from the tumour causing pressure on local structures. So this could be a persistent cough, and that's caused by involvement of central airways. You've got hemoptysis, and that's coughing up blood that's come from the tumour. You've got a hoarse voice, and that's due to invasion of the recurrent laryngeal nerve, typically on the left-hand side. Breathlessness and wheeze will be due to large airway obstruction. However, breathlessness could also be due to a pleural effusion. If you remember, you can get transudative and exudative, and exudative pleural effusions can be caused by cancers. You might also get chest pain if there's chest wall involvement. Both Horner's syndrome and Pancoast syndrome can be caused by something called a Pancoast tumour. This is a cancer which is found in the apex of the lung and involves the nerves C8 to T2. Pancoast syndrome is when this tumour causes shoulder pain which radiates down the arm in an ulnar distribution. And Horner's syndrome is when you get a group of different symptoms. So these are ptosis, meiosis and anhidrosis. Ptosis is where you get a droop of the upper eyelid, meiosis is constriction of the pupil, and anhidrosis is the absence of sweating. Pancoast tumour is only one of the causes of Horner's syndrome. And the reason that you get all of these different signs is because it's infiltrating the sympathetic nervous system. So you're getting increased expression of the parasympathetic nervous system. Hence, not sweating, constricted pupil and drooping eyelid. You're going to sleep, you want to read your book, and you're not sweating because you're not running away from anything. I'm just going to rub this out so we can talk a little bit about SVC obstruction. So when we say SVC, we're referring to the superior vena cava, and that's the main way that blood drains from the face, from the upper extremity, from the upper thorax, to come into the heart. Because it's a vein, that means that it's quite squishy. And so we've got this tumour causing pressure, and one of the things that it's causing pressure on is the SVC. This means now that the lumen is so much smaller. Because of this obstruction of flow, it increases venous pressure, which then causes edema. as well as backflow. From knowing this, you're able to kind of guess what a lot of the different symptoms of SVC obstruction are. So we know that blood isn't getting through the heart to get oxygenated, and therefore the most common presenting symptom is shortness of breath. We've got this edema and backflow, so you're likely to have facial swelling, arm swelling, and the patient might complain of head fullness. SVC obstruction is an oncological emergency, and that's because it can lead to things like cerebral edema or decreased cardiac output. So hypercalcemia is a raised calcium level, and with lung cancer this can be due to a release of parathyroid hormone related peptide which acts on the bones to cause them to break down and release calcium. However, it's important to know that actually with lung cancer, if you see someone with a high calcium level, this is more likely to be due to bone mets than to a paraneoplastic syndrome. So in SIADH you have inappropriately high levels of antidiuretic hormone. And so if you're thinking diuretics are making you pee, antidiuretic hormone is causing you to retain that water. So you're having more water absorbed in the kidneys and causing it to dilute the sodium. A high amount of ectopic ACTH secretion would give you Cushing's syndrome, so you'd expect to see the symptoms of that. However, these don't tend to present in lung cancer patients, as often acetylcholine receptors have passed away before the symptoms can occur. Whereas in Lambert-Eaton, it is the voltage-gated calcium channels. This presents with muscle weakness. Paraneoplastic syndromes are particularly seen in small cell lung cancers. Now we're going to move on to talk about the different types of lung cancer. If you imagine that you're smoking a cigarette, this cigarette smoke will go in through the lungs, down to the hilum, into the bronchi, and then out to the rest of the lung. If you look at that, you can see that the highest concentration is going to be at the hilum or in the central airways, with a much lower concentration reaching the peripheral airways. That's something that's helpful to know when thinking about where the different types of cancer are located and which ones are more strongly associated with smoking. Our squamous cell carcinoma tends to be found in the hilum, our small cell carcinoma in the central airways, and the adenocarcinoma tends to be found peripherally. The ones found closer to the centre are more strongly associated with smoking. And adenocarcinoma is the one most often found in non-smokers. These are the most common types of lung cancer, but there are also other types, and you might see cancers from all over the body inside the lung, and that's because the lungs are the most common site for metastases. In men, the most likely tumour to metastasise to the lungs is malignant melanoma. For women, it's most likely to be breast cancer.